I have a diploma in interfaith ministry, and I also studied psychology in college. I've been doing pastoral counseling since I first became a priest. Most ordeal masters I know have at least basic psych. All of us have first aid, CPR, and universal precautions. Some have gone through OSHA's courses. I got my training at the Red Cross. I know ordeal masters who've taken training as EMTs. One of my assistants is a nurse. Most of us have basic psych and basic first aid. Most of us have more than that. Then there's the physical training, the hands-on training that we had to do to learn how to do the techniques that we use.
So this is something that you take very seriously as your sacred duty.
Absolutely. Ordeal can hurt. Ordeal can be intensely painful. It should never hurt. It should hurt because when you stick a needle through someone's skin, it hurts. It should not hurt because the ordeal master is incompetent. And I consider this a sacred practice. If I did not take care to keep my first aid skills up to par, if I did not take care to keep learning in psychology and counseling and how to deal with the aftermath of trauma counseling, I would be failing in my duty as a priest, not just as an ordeal master. I would be desecrating something that is very sacred.
By now, there are enough people who've heard of ordeal work that some people are going to throw themselves out there as I know what to do. Basically,
no, you don't.
When you're looking for an ordeal master, what questions do you ask? What do you need to know?
I want to know where they were trained. I want to look at their life. You don't want an ordeal master who can't keep their personal life together. Are they sane? Are they solvent? Are they living responsible lives? Everybody has crises occasionally, but you want to avoid someone who seems to be reeling from personal crisis to personal crisis. That's a huge red flag. Most of all, I want to see their scars. I want to know that they've walked the territory. I want to see the marks on their flesh that tell me where they've been. Because you cannot guide someone across a threshold that you yourself have not walked. I want to know that you've gone down into that abyss and that you've come back. And if you can't show me your scars, then I don't want you as an ordeal master.
Tell me about the process of building an ordeal for an ordeal seeker.
First, I would do divination and prayer and meditation to make sure that I am the person who should be doing the ordeal. That the ordeal is necessary, that it's something the seeker should be doing. Before anything else, I do divination. If that all looks positive and says yes, yes, and yes, I sit down and interview the person extensively, usually for a couple of hours. I want to know what their thought process is, why they're doing this, what their relationship with their deity is. And as I'm doing that, I'll probably also be keeping an open head to the deity in question. If all of that's satisfied, I want to make sure that they're mentally stable. If all of which, with my counseling background, yes, I can determine. If all of that works out, I have them sign a release form and a consent form. These are filed. And then comes the meditation and possibly the research and the putting together the appropriate team and the networking with the ordeal seeker. What are they trying to accomplish? What does their deity in question want to accomplish? What techniques can be done? I need to know a full medical history. I need to know what medications, if any, they're on, because there can be side effects. I need to know a psych history. I want to know exactly what might happen mentally, emotionally, and physically when this person undergoes the stress of an ordeal, because an ordeal is a situation of controlled stress. It's controlled, it's carefully structured and controlled trauma. So once I have all of that information, we start talking technique. I need to know as much about their physical condition as possible. And then I'll sit down with my team, and I might consult with senior ordeal masters. And I'll put together the appropriate ritual. And we'll schedule a time, and I will give them instructions on how they should prepare themselves. And we'll do it. But it usually takes at least a couple of weeks.
What are the things that you are focused on and doing while you're doing the ordeal?
My first job is to stay as open as possible to that person's deity. Whatever that deity wants, I need to be ready, willing, and able to deal with that. And I'm very, very keenly watching and reading the ordeal dancers' psychological state and emotional state, and their physical cues. Because an ordeals can break a person down, and that's fine, but it's a controlled faceting. It's like faceting a diamond. You hit it the wrong way and it can shatter, and that's not the purpose of an ordeal. I need to be very sure that I gauge everything accurately. So I'm observant. I'm open to input from the gods, but I'm observing cues from the person. And we will have negotiated what is going to happen well before the ordeal begins. The ordeal dancer may not be able to know everything, because I find that most of us are control freaks, and that's counterproductive to the type of opening that ordeal brings. But all of the boundaries will have been negotiated. So my job is to stay open to input from the gods and to observe very, very carefully the progression, the psychological and physical and emotional progression of the ordeal dancer. I need to take them into this, let them have whatever experience they're going to have, and bring them safely out again. And if I can't do that, I have no business leading an ordeal. It's very much like leading a ritual. You create the sacred space, you guide the person into that space where they can, as safely as possible, engage with their gods, and then you lead them out again and return them to Chronos, mundane time, as opposed to Kairos, sacred space and time. Ordeal's the same thing, it's just the techniques are different.
After the ordeal dancer has completed the dance.
That's a good question. I like to make sure that the ordeal dancer, the part of the team, is someone, at least one person, who is going to be there to care for that ordeal dancer afterwards. I like to have someone there who is not going to be part of the ritual in any way, shape, or form. I find that some ordeal dancers just really don't want to see anyone engage who was part of the ordeal afterwards. They need time and space away to reconnect with the human world, with the regular mundane time to process everything that the ordeal has brought up. But I watch them and I check in with them, and I may check in with them for a number of days. In some ordeals, I'm checking in weekly for over a year. You don't just let them go. You are responsible for helping them transition back into daily life. And that means doing whatever follow-up they need. And that's something that you learn, I have to say you really learn by experience. But always I try to make sure that there's a support network for the ordeal dancer in place before the ordeal. Before you start jumping into ordeal for yourself, try to get your ancestral house in order. They are your support and your strength. Make sure that you have an engaged devotional practice with your gods. Ordeal's not about us, it's about connecting. I had a student say to me recently, in talking about being bound to her gods, she said the leash has two ends. It's not just about our end. It's about their end too. So understand that this is bigger than you. Make sure you have a support network. Work hard to get your life in order. And if it means going into therapy and dealing with issues, do it. Ordeal's not a substitute for the hard work of living a responsible life. Ordeal is not a substitute for devotion. Ordeal is not a substitute for doing the work that it's necessary to do to become a responsible and engaged human being. Ordeal might be part of that process, but it's not a substitute. Find your drama somewhere else.